I'm in an appropriate appearance today. I have my uniform on, my ID badge, my hair is pulled back, and I brought all the necessary equipment in order to carry out the exam today. Hi, I'm Whitney. I'm going to be your student nurse today. Can I get your name and your date of birth?
Anna Kaiser, 10/28/99.
Okay, can I just check your ID badge real quick? Okay, thank you so much. So today we're going to be just doing a basic health assessment. So if you have any questions, go ahead and let me know. I'm just going to be explaining things as we go. I'm going to go ahead and draw the curtain over here. And I'm going to be providing comfort for you throughout the exam, so just let me know if you need anything. But first off, we're just going to start off with a temperature. Just going to take this right across your forehead. Next, I'm going to be taking your blood pressure. Is there a specific arm that you prefer?
Probably my right arm.
Your right arm?
Mm-hmm.
And do you know what your blood pressure is normally?
I think it's like 120/80.
120/80?
Mm-hmm.
Okay. So it's normal to feel a little bit of pressure as I do this, but no pain should be present. Okay. Next, I'm going to be taking your heart rate on your wrist. Just going to be taking it for 4 minutes. Okay, and while I was doing that, your heart rate was normal, so I only assessed that for the first 30 seconds and it was regular. And then I went on and moved on to counting your respirations. And I was noticing that those were also a regular rhythm, and I wasn't noticing any excessive effort being used, no retractions or accessory muscle use, and that your breathing seemed to be bilateral in both sides of your chest. And so now I'm going to move on to taking your pulse oximetry. Pulse oximetry. Oh, looks like it fell on the ground. Going to be placing this on your finger. This is going to be taking your blood oxygen levels. Okay, and have you had any pain that's brought you in?
Yeah, I do actually.
You do, okay. How did that happen?
It was when I was working out.
When you were working out?
Mm-hmm.
Okay, and where in your body did you hurt?
My right knee.
Your right knee,
Mm-hmm.
okay. And how would you characterize that? Is it a sharp pain, more of a dull pain?
More sharp.
A sharper
Mm-hmm.
pain? Okay, and is there anything that makes that pain feel better or worse?
It's better when I get a chance to rest, but it's worse if I'm on my feet all day.
Okay, and is that pain just sticking to this area, or is it spreading to others as well?
It shoots down my leg sometimes.
Shoots down your leg,
Mm-hmm.
okay. And would you say that that pain comes and goes, or it just is pretty constant?
Comes and goes.
It comes and goes?
Yeah.
Okay, and how long ago did you hurt it?
3 days ago.
3 days ago?
Mm-hmm.
Okay, and on a scale of 0 to 10, 0 being no pain, 10 being the worst pain ever, how would you rate that pain?
Probably a 5.
About a 5, okay,
Mm-hmm.
that's pretty serious, okay. Well, next I'm just going to move on to a general appearance check, and it looks like overall you seem to be in a good state of general welfare for your age. I'm also not noting any signs of acute distress present, but just a few questions. Do you know what city you're in right now?
We're in Newburgh.
In Newburgh, okay,
Mm-hmm.
and do you know what your age is?
I'm 21.
Okay, and do you know what day of the week it is?
That's Monday.
Okay, so I'm noticing that you're alert, aware, and oriented ×3. And while we were talking, I was noting your facial expressions and that they are appropriate for the topic and the conversation we were having. I was also noticing your speech was clear and articulate at an even pace. And so next I'm going to have you go ahead and walk to that wall and back for me. And while she's walking, I'm noting that her body movements are smooth and coordinated. Her stature seems to be symmetrical bilaterally. I'm also noticing, and she had a steady gait. I'm also noticing as she's sitting that her posture is erect and her position is relaxed. And so as far as nutrition goes, about how many meals a day have you been getting?
Usually 3 full meals.
3 full meals? Okay, that's wonderful. I'm also noticing while we're sitting here that her appearance is appropriate and her dressing is appropriate for the situation and for the weather. And she also appears to be clean and well-groomed with neat hair, moderate makeup. I'm not noticing any particular odors. So we're going to move on to an assessment of the hair, skin, and nails. So first off, just looking at her skin color, it looks like her pigmentation and coloring is consistent with her racial heritage. I'm also noticing that there's no pallor, cyanosis, erythema, or swelling present that I can see. As far as skin lesions go, have you noticed any recent cuts, bruises, moles, rashes?
No, nothing I'm worried about.
Nothing you're worried about? Okay, good. And if you did have any, I'd be also noticing their color, their elevation, their shape, their size in millimeters, location, distribution, and if there's any exudate present. But I'm going to go ahead and just inspect your skin temperature. Okay, so I'm noting that across your body it feels warm and equal. I'm not noticing any moisture present with that as well. Can I just see the back of your hand real quick? I'm just going to give it a light pinch. Okay. And there I was seeing no skin tenting, so I'm not worried about any dehydration with that. But as far as your hair goes, have you noticed any recent hair loss or maybe a change in texture?
No, nothing I'm worried about.
Nothing you're worried about? Okay, I'm just going to take a quick look at your hair. Okay, I'm noting that it's evenly distributed. I'm not noticing any dry scalp or any parasites present. And as far as your nails go, have you noticed any shape with those, maybe a change in texture or some brittleness?
No, they're normal.
Normal, okay, can I just take a look at your nails? Looking at your nail beds and seeing that there's no clubbing present or discoloration. And if you had an IV set, I would also be assessing that for any erythema, swelling, or drainage, but that's not the case right now. And so as far as sensory deficits go, have you noticed any issues with sight, smell, taste?
No, nothing like that.
Nothing like that, okay. So next we're going to move to a Braden scale assessment, where I'm going to be assessing your risk for skin breakdown. So the first section, sensory perception, I'd rate you as a 4 as you're able to respond well to verbal commands, and you didn't report any sensory deficits. For skin moisture, I'd also rate you as a 4 because your skin was warm and dry throughout. And then as far as activity, I'd also rate you as a 4 because you're able to walk with ease earlier when I observed. And for mobility, I'd rate you as a 4 as you're able to easily get up and out of the bed with full range of motion. And then as far as nutrition, I'd rate you as 4 as well, as you reported getting 3 full meals a day. And then for friction and shear, I'd rate you as a 3, as you're able again to easily lift yourself up, so there's not really that risk of shear happening. So your overall Braden assessment score would be a 23, meaning that you're at no risk for skin breakdown, which is great. So next we're going to move to an assessment of the head and the face. So just looking at your head and face right now, noting that they are bilaterally symmetrical. And do you wear glasses?
No, we don't.
You don't wear any glasses? Okay. So I'm just going to take a quick look at your eyes. I'm not noticing any eyelid abnormalities, no cloudiness of the retina. I'm going to take my pen light here and take a look at your pupils. So I'm noting here that they are both equal and round. And then you can go ahead and look at that wall for me. Okay, equal, round, and equally reactive to light. You can go ahead and watch my finger. Okay, they are accommodative. Can you keep watching it for me, not with your head? Perfect. Right now I'm testing her extraocular movements, muscle function. Okay, good. And have you had any hearing issues, maybe using hearing aids?
No, nothing.
Nothing? Okay. So for that I'm going to be assessing your ears real quick. Looking at the external ear, looks clean. Inner canal, not noting any cerumen, foreign bodies, or signs of otitis. Just going to palpate your auricular node, not noticing any tenderness or swelling there. I'm going to do the same thing to the other side. Okay. And then for hearing acuity, can you tell me if you hear that?
Yeah, I hear it.
Okay. What about this side?
Yes.
Okay. And if we were able to safely unmask, I'd also be looking at your nose for symmetry and mucosal color. I'd also be palpating for any nostril patency or sinus tenderness. And I'd also be looking at your throat and your mouth with my pen light, and would be just looking at your dentition, your gums, your tongue, your palate, salivary glands, and your tonsils. But since we can't do this today, we're going to go ahead and move on to an assessment of the thorax. Since we already assessed your respirations, I'm just going to go on to looking at you. Can you turn to the side for me, please? Okay, I'm looking. It looks like skin color is appropriate on both sides. Looks like your spine is nice and straight. Your AP diameter appears to be a healthy 1 to 2. Not noting anything there. Okay. I'm going to go ahead and have you lean back. Looking at your jugular veins, not noticing any distension or pulsations. You can go ahead and sit up for me again. I'm going to check your trachea. Appears to be midline. Can you go ahead and swallow for me? Okay, I was checking for thyroid and larynx and didn't seem to be any present. I'm just going to palpate your cervical lymph nodes, no swollenness there. Can you go ahead and turn aside for me again? Okay, and while she's breathing, I'm not noticing any pulsations, lifts, heaves that are abnormal. And I'm going to go ahead and come behind you right here. Place my hand at the bottom here. Can you go ahead and take a deep breath for me? Okay. Chest movement was symmetrical bilaterally while you were doing that. And I'm also checking to see, okay, it looks like temperature is nice and even. I'm not noticing any masses, lesions, crepitus, or tenderness present. So next I'm going to go ahead and start listening to some of your lung sounds. So every time the stethoscope touches your chest, if you could just take a deep breath in through your mouth and out your mouth. And if you get lightheaded or you need to slow down, just let me know. We can go ahead and slow things down a little bit. Okay. I didn't note any adventitious sounds. We're going to go ahead and move to listening to the back. I didn't know any adventitious sounds there either. Just a few quick questions for you. Have you had any issues with shortness of breath?
No.
No? Okay. And have you had a family history of lung disease?
No, nothing like that.
Okay. And then moving on to your heart, have you had any histories of high blood pressure that you've had?
I have in the past.
You have in the past had some? Okay. And have you had any family history of heart disease?
No.
No? Okay. So we're going to move on to an assessment of the cardiac. And I'm going to go ahead and listen to your apical heart rate for a full minute.
Okay.
Okay. Now we're going to move to listening to your heart sounds in 4 different locations. So this might take a little while, but don't be alarmed. I'm just getting a good listen to it. And listen first with the diaphragm on my stethoscope. And the rate and rhythm was nice and even, and S1 and S2 were both present. I didn't hear any extra heart murmurs or sounds, but I'm going to go ahead and listen again deeper with my bell of my stethoscope. Okay. Again, your rate and rhythm was even, and S1 and S2 were present. And I really have not noticed any heart murmurs or any extra heart sounds. That's really good. But for the last thing, I'm going to go ahead and listen to your carotid arteries. So when I place my stethoscope, if you could just hold your breath for me, that would be great. Okay, go ahead and take a breath to the other side and hold it. Okay. And I didn't notice any bruise present when I was listening on either side of that. But that concludes our health assessment today. So thank you so much for coming in. It was nice to meet you, Hannah.
Okay, thank you.